it's highly possible that we may not be aware of something which is very slow and progressive. Very slow and progressive. The common examples of them are the transition of the weather, the climate from this to that, transition of January to February and beyond, and suddenly you find the year is gone and time to celebrate again. It's time to again celebrate by cutting a cake and probably changing yourselves 1 year, less younger, older, which you celebrate, clap, but you grow 1 year older. Friends, body is not a statue. Body is an amazing computer which transforms itself day after day, year after year, and a trajectory of growth, hormones, profile changes, all those positives, then plateaus at any age group, which could be late 40s, 50s, 60s, and thereafter there is a downhill curve. If we don't believe that health is a progressive change which happens to us, we may miss out many other things, and including quality of life issues which actually is missed out. The common example of that is men living with prostate changes very progressively. They may be doing an annual health checkup and looking at the prostate size, a PSA level, which has got very minimal meaning. The meaning is about what is the prostate doing to you. Prostate is like a trap door. A trap door, which is a gland of a very small size, which undergoes a progressive change in life from the mature 30s, 40s to 60s, 70s, and 80s, and for all men. No men escape it. Most of the men go through clinical signs and symptoms in 50s, 60s, and they are at that time mature, strong, and capable enough to overturn this progressive change by compensating. So what happens? The bladder continues to contract more erratically with more force in a background of an obstruction of the trap door, maybe increasing in size of the prostate, but decreasing the caliber of the urinary passage, which narrows down completely. And one fine day may completely get blocked. So progressive change in all men in 40s, 50s, and 60s is really not recognized. Let me confess that men complain, and when they complain, it's too late. When they complain that there's an obstruction to the flow of urine, I think we already crossed boundaries. We have already moved much forward than what it could be, where reversal always becomes a challenge. Somebody comes with complete blockage of urine. Somebody comes with passing in drops. Somebody comes with a very narrow stream. Somebody is forcing urine out and is passing something and holding a lot of urine. Imagine all these four people. Look at this scenario again. Somebody is completely blocked on a catheter. Somebody passing in drops. Somebody is passing with a very narrow stream and straining. And somebody just strains, pushes, and still does not empty completely or incomplete evacuation of the bladder. And all these four people have actually progressed in life over months, years, and decades to a point in time where the obstruction became very significant. So friends, prostatic obstruction is not picked up on ultrasound, is not picked up on a PSA report. It's picked up by you by looking at your IPSS symptom score, International Prostate Symptom Score, and by your urologist who is deeply interested in you. He wants to pick this up and take it to the next level, where he will pick up and probably identify you as to what level you are. Prostate changes are ubiquitous. Men at all ages undergo change, but it's only tested by one simple test called the uroflowmetry. As I said, the performance of the lower urinary tract is completely a phenomena that men and women have to undergo through. That means the lower urinary tract is to be significantly worked up, and that happens in our lifetime as we learn, adjust, become continent, dry, and then continue to store and pass urine. And the entire aspect is a lot to do with the bladder. The urinary bladder stores urine. Its job is to store urine and store till you are socially in a location where you can open your zip and pass urine. Imagine this. The bladder only contracts when you as a master allow it to contract. When you reach the washroom, open the zip, and everything is concealed in a social location. Imagine what happens when the bladder suddenly starts contracting erratically. You will have to pass urine again and again. And that's where the whole wake-up call is. The whole wake-up call is this bladder is erratically contracting and compensating in the background of progressive obstruction happening. I said this is going to be happening to all men. Obviously, in some 40s, 50s, we pick them up early, very young, and some in 60s, 70s, 80s, and 90s. So if you pick up early, it's great to be able to then complain to your doctor, or your doctor picks it up for you when you reach your doctor with some complaints. So if you have complaints of urinary obstruction, not able to pass urine well, or not able to control urine too, because by that time the bladder has actually learned the habit of secondary overactivity because it is now traumatized with the tightness of the urinary passage. It cannot overcome, so it learns an erratic behavior of a hyperactivity or an overactivity of the bladder that you call a secondary overactivity, de novo to the obstruction developed downstream as a result of resistance increase. And what do? It's time for us to wake up. We wake up to a phenomena of reaching our urologist in our cities, in our towns, our countries, to be able to complain, to be able to lay forward or plead our case in terms of the obstruction. So you would complain something to your urologist and he will pick it up and probably treat you. But what happens upstream, the bladder silently suffers the agony. And that's where I'm coming to. Save the bladder today for better tomorrows. Because prostate I could treat today, tomorrow, day after, a week, month, year, or a decade later. Initially with medicines, failing which I know we move up the ladder algorithmically to even operate you, which is by many techniques. In the era, there was an open surgery, then there came endoscopic surgery. For very large prostates, to spare the urethra, we go robotically and clear the prostate internally at the Kokilaben Dhirubhai Ambani Hospital in Mumbai. And all the modalities exist in my 25 years of career, where I continue doing open or endoscopic or robotic or the minimal invasive surgical treatment that we do is all for the prostate. But what about the bladder? The bladder is an organ which undergoes a progressive change as a result of its change in elasticity that happens around. So elastic organ which was able to contract and relax is now forced to contract more against a resistance. Is also probably forced by you to stretch more, and therefore the fibers undergo a complete change. You look at these fibers are all showing trabeculations, there are diverticular formation. It's all about a senile change happening in very early in life in an organ that's not visible to you. You can see only your face, your hairs, your clothes, which are visible to you and appeal to you. But doesn't appeal what? Is a change in the bladder which is progressive and obviously almost permanent. So friends, Save the Bladder is a project which needs to be woken up by all of us. We are missing it out. Every week, week by week, month by month, year by year, I continue to speak on this to colleagues, to patients, and to many. There's a scientific evidence to it that as we allow the bladder to decay, to deteriorate its function, which was a good elasticity and contracticity, now that goes off completely. And thereafter, the bladder turns more hypocontractile, more hypotonic, unable to probably push urine out. It's just not their behavior too. Also the diseases like spinal cord diseases, neurological diseases. And why all that? Diabetes mellitus. Diabetes uncontrolled, diabetes long-standing could also bring about changes in the end organs. Bladder, penile organ, eyes, kidneys, these are end organ blood supplies. And the bladder suffers in long-standing diabetes, with changes happening akin to what is seen in hypocontractile atonic bladders. The bladder sensation goes down. You really can't sense a bladder. You're holding a lot of urine. And many a times you may not know you have a pregnant bladder. The bladder is too full, there are very high residual volumes, and you don't mind. Somebody in the front is worried and anxious about you, called the urologist, but you may not feel so much. By the time you wake up one day, there could be changes in the bladder beyond a point in time. It's not a scare, it's a reality, it's a truth. I face all 7 days a week in my career as a urologist, and all my urology colleagues do face the similar thing across the globe. So friends, save the bladder. Save not the gallbladder, which if disease has to be removed. Save the urinary bladder because you can't get another bladder. Though we do reconstructions of the bladder, though we make neo bladders from the intestines in cases of interstitial cystitis bladder pain syndrome, where the disease has decayed into a stiffened bladder, which is a small capacity end stage bladder. Let's not allow an end stage bladder in a hypocontractile bladder, which is through no fault of yours, but sadly through a minus awareness, and awareness which is missing in the society and missing completely on the Google. So it's a wake-up call. It's a wake-up call on the prostate, it's a wake-up call on the bladder. If you have to strain, force, push urine out, like sometimes you're constipated and you sit and push a lot of hard stools around, you're actually straining around. Now that straining brings about changes downstream in many locations. But bladder cannot be reversed again. Once you're 50, you'll never become 49 again. Once 2024 is gone, it's going to be 2025 all through till the end of this year. And every day, every month, every year that you pass urine with straining, forcing, pushing urine out, the changes are always ubiquitous. They are going to be progressive. The bladder will learn a behavior, and thereafter abdomen will push the bladder because bladder is losing a tone. I'm not sure if there's any treatment available at this point in time. People talk about treatment and cure. There's no cure for hypocontractile atonic bladders. So people come with a lot of hope. And the only treatment that we can then give is on the evidence-based therapy of doing a sacral neuromodulation or to modulate the bladder, that too very early. A hypocontractile bladder may be modulated, but an atonic bladder, which has absolutely zero tone, absolutely silent bladder, will be completely lost on all occasions. And therefore, sacral neuromodulation has come to stay as a therapy for a lot of disease, progress, bladders. On one side become agony, pain, discomfort, where treatments are not happening and nothing is helping you out. On the other side, modulating nerves for a bladder which has become hypocontractile, does not push urine out, and this change is also sadly progressive. So friends, quality of life diseases are something which we probably miss out. These are slow, progressive changes on men's urinary tract because prostate is a male gland. Its involution only happens when the hormones are not there. That means late 80s and 90s, or in prostate cancer where it's a spread disease, we bring about a change in hormone and bring about anti-androgen therapy. Otherwise, a prostate therapy needs to be done in time. Has walked in this important minimal invasive surgical treatment where we treat prostates in time. We open the prostate so that the flow continues to be good and you don't have trouble around. I'm sure this is not going to be an easy talk for us to imbibe because it's not you and I are going through. But yes, our relatives, our friends, our neighbors, and our seniors are going through it and they cannot see it coming. They can only see it coming if they do a health checkup to a urologist by doing a proper uroflowmetry. When I see a uroflowmetry, it's like an ECG. ECG tells all about your heart. Similarly, uroflowmetry is an ECG of the bladder which tells you reality about your heart. It really tells you about the reality of the heart of the pelvis called the bladder which pumps. It obviously pumps to your commands and locations, but as time changes, it is no more your slave. It becomes a master. It probably then loses out as master because from a secondary overactivity which it develops and gives you frequency, urgency as a male, soon it will lose its power. And therefore, don't postpone urinary health as a man, as a male. Because late 40s, 50s onwards, these progresses do happen to everybody. In some minor, in some moderate, in some severe. And I feel very happy when I see somebody in 60s, 70s and 80s who comes with health checkup and says, I've come to see you because you told all this on the channel. I said, completely fine. I'm happy that you are completely stable and you are safe enough to leave my room and be back again as requested and required to come back. So friends, save the bladder, number one. Number two, pick up your urinary changes in time. If you pick up one, don't keep popping medicines for prostate. It doesn't help you. You got to look at, there has to be a treatment for some conditions. There has to be cure for some conditions. If you have crossed the bridge already, treatment will not help. Treatment will only be prolongation of internal silent agonies, which probably will never come back again. So friends, it's important for us to wake up. Wake up call on many things which are not probably documented very strongly in history and in science. But the science is visible out of the daily work, clinical work and the research that we go through as urologists. Ask a urologist what is the treatment of hypotonic and hypocontractile bladder. And he would say, you will have to live on catheter all your life or do a clean intermittent self-catheterization. I've seen that for the last 24 and a half, 25 years. That this is sadly a situation which many men go through. Recurrent UTIs, infections, bleedings, tell me what not, and finally a suprapubic cystostomy. Treatment is available. But if you have really missed out and crossed the bridge to the other side of midnight, then we have got sacral neuromodulation to treat you, to get you back on feet, to bring you out of catheter, to lower down your bladder volumes after voiding. That's called post-void residue. But all this why? So for everything, there is a treatment and a cure. But it's always a wake-up call to pick up things in time. You pick up things in time, you probably do well. Your algorithm towards age-related changes, which is going to happen to everybody, which we refuse to believe in younger age group, will actually be completely solved. So solution today is cure. Cure is about listening to all this awareness, which is important for you. And you heard the awareness, don't sit tight. For changes which you have not seen, are changes already happening. For changes which are happening, there is a solution only when we diagnose. And we diagnose when you see your urologist in your locations, in your cities, countries, etc. So friends, as men in our 40s to 80s, amazing changes happen in men's health, in urinary and sexual health. But living in agony and disgust and distress is not a way out. In modern world, it's all about health. A better health today is probably a safer health tomorrow. Else, it's all about coming into the world through hospital and going through the hospital. So urologist is always important for you in terms of whatever changes to happen in evening of life. But I think we're keen to safeguard ourselves today for better tomorrows. And that's where we come back on this platform again and again to speak to you, to make you aware that prostate health is important. I'm not talking today of cancer, which I continue to deal all 6-7 days a week in the urinary bladder, in the prostate, in kidneys. I keep requesting people to quit smoking, else a smoker comes with a kidney cancer this year and probably comes with a bladder cancer next year. Years later on a follow-up, we find he has got a lung or a nasopharyngeal cancer. So anything which could be prevented needs to be prevented. Sadly, a heart talk that came today, but the heart talk is to wake up a lot of people who are smokers, who are postponers, who have got urinary issues, who have got uncontrolled diabetes, who have got issues where only taking medicines, no result, no evaluation, not done a uroflowmetry, not gone and seen a urologist. Things do change. Friends, it's a wake-up call and we're all aware of ourselves better than ever before. So let's take it forward to the highest possible level. Thank you for hearing to this, because have you heard this? It's a wake-up call for you. I'm Dr. Sanjay from the Kokilabhen Dhirubhai Ambani Hospital in Andheri West in Mumbai, dedicated to the passion of spreading awareness to a lot of individuals who may not be knowing this subject at all. They've been just treated on medicines. Their polypharmacy prescription always carries a drug for prostates, for bladders, without knowing why they eat. And one fine day they come over with an emergency after long many years wasted and progress to a point of no return. Wake up again, bring your health to the front row seat on all aspects, but a quality of life care which can be brought about on prostates is around the corner. Thank you again.